because this might be the most formal brief I've ever given anybody down here in Miramar, so it's kind of exciting. I'm happy to share the PowerPoint. So I am Elisha Logan. Is there an echo? Is that better? That's okay. All right, so I'm from the Psychological Health Outreach Program. We are a Navy Bureau of Medicine program created to support Marine and Navy reservists. Okay, I'm looking to see who's in this picture over here. So this was taken at our annual training in 2019, not in 2020. Obviously, it was disappointing that we had to cancel. But we are a program of licensed mental health professionals. What we don't do in our role, though, is to make a diagnosis or to do any treatment. Okay, but our role as licensed mental health professionals is to be able to assess a need someone might be having and to make appropriate recommendations based on any needs. Okay, we are here to support your family members as well. It's not just the reservists. And I think sometimes people don't realize that we also support the I&I. Even though you guys are active duty, you're part of the reserve, and so we're here to support you as well. What we're here is to increase your resiliency or maintain your resiliency. So who we are. Our program is free, okay, and it is confidential. The only limits to confidentiality that I have are imminent risk of suicide, homicide, child abuse, or elder abuse. Okay? Everything else is confidential. And even when I do have to share with one of your command, if there's a high-risk situation, I only share what is needed to know. Okay? The details that you share with me stay with me. My commitment to the command, if there is high risk, is if that person is still communicating with me, if they're getting connected to services, and what the risk level is. But all the other information you share with me about yourself is confidential. Phop is also voluntary. Okay, so I get referrals a bunch of different ways, and if I ever send you an email or call you or text you, you can decline any support from Phop. But what I do ask is that you at least tell me that. Sometimes we spend a lot of time calling people and emailing and things, and I feel like that's probably annoying to you. It's just super easy to shoot me a text and say, no, I'm not interested. And I let leadership know that as well. We cannot force anybody to participate in Phop, so it's just a very important piece for everyone to know that we're confidential and we're voluntary. And our eligibility is what I had just mentioned before. Okay, so we focus on the reserve population, which is a very special population. As I mentioned before, I'm able to also work with the I&I staff, but they have resources available to them that the reservists do not. That's part of why you're unique. Also because you have dual lives, right? You have the responsibility of still having a full-time job, but also having your reserve responsibilities. So you guys are very special. Okay, where are we? Let's see if this is up to date. These are all the places where we have offices, okay? And we've expanded a lot. I joined the team in 2017, and right at that time, the San Diego office was only up at Camp Talega. Who's been to Talega? Who thinks Talega is fancy? I saw one hand. I remember the day that I came into my office and I saw a mouse had eaten through my peanut butter jar. So I was anxious to get out of there. So actually, MWCS 48 didn't really know it, but they created the first satellite office with me. I live in northern San Diego. I did not want to drive up to Orange County every day. So as long as I was allowed to use office space here in Miramar, we had a satellite office. And that's why we have all these different offices there. So everybody who supported me during that time, I'm really grateful to, because I would sometimes just rotate from different office to office if there wasn't space when I needed to be here. So we're in all these different places. Oh, by the way, I always forget to mention the Navy. I apologize for that. I'm just kind of Marine-centric. But we do support the full-time staff as well with the Navy. So what do? We educate. So sometimes we are asked to give psychoeducational briefings on things like stress management or suicide prevention. This year we're doing a hard push for means safety, and I'm going to give my first brief this morning later on about means safety. You know, it's really important to help limit access to things that are lethal like guns and medication. So that's part of our education. Sometimes we might get somebody from leadership who has a concern about a service member and they're not really quite sure what to do. So we offer support in that vein. Assessment. We have an online behavioral health survey. Has anybody taken it before? Yeah. So it asks a lot of different questions, you know, including demographics. But the most important part of that survey are the questions related to anxiety, depression, PTSD. They do not diagnose, but it helps me see if somebody's experiencing higher than normal or usual or standard symptoms of those things. And then we talk about what's going on. I have to assess, is this just a circumstance? If I were to assess most people in 2020, I would think that their anxiety scores would be more elevated than they would have been in 2019. So the scores don't mean anything without my conversation with you, to put it in context. Okay, and we make referrals. So if I am talking with somebody and I feel they would benefit from a full behavioral health survey, a full behavioral health screening, then I will make that recommendation and we'll talk about where you could go to get that done. Which is why I'm always going to make a little push for making sure you guys have your TRICARE Reserve Select. Okay, because if you need counseling and you don't have health insurance, it just becomes that much more difficult. And if you have any questions about TRICARE, you can just talk to me later. And then we follow up. So if I send you a one-time resource, I'm going to send you probably a text message and say, hey, I hope that resource was helpful. You know, please let me know, otherwise I'll close your case. And it's good to find out whether it was successful or not, because if I give you a resource that worked for you, then I'm going to save that resource and maybe be able to use it for somebody else in the future. So your feedback and the follow-up is really important. Okay, so one of the things that I think is just really important to mention in this slide is even though we're called psychological health outreach, we do not only deal with psychological health, mental health matters. I think that a lot of people think if somebody's not dealing with depression or something like that, that PHOP isn't relevant. Well, you can see this list down here. If you're having a stressor in any of those areas, that's going to increase some maybe depression or anxiety. It might only be temporary, but it's still important. So we do resourcing for things from helping people get connected to job opportunities. The financial piece is always hard, but we make an effort. If somebody's looking for, you know, money for something, you can't just find money, but there's other resources like food banks or places that you can go get a free meal. So if you're tight with cash and you can go somewhere and save $30 in a food pantry, that could be gas in your car. So all of our resourcing is helpful to support your stability and your resiliency. You guys familiar with this? Are you doing a training on it this weekend? The Oscar?
About 30 minutes ago.
Yay! So the next time I talk to one of you in my office and I say about the ask, you know what we're talking about. So this is a Navy kind of gauge of stressors, and I'm just going to give you my version of it. Because where it says red, it talks about diagnosable. And this is what I teach our new team members, you know, as I'm training them. You can be red and not have a diagnosable condition, okay? So if I just found out that a close family member passed away, I'm probably going to be red. Maybe I'm feeling anxious, maybe I'm feeling depressed, but that doesn't mean there's a diagnosis there. It means I'm having a normal common reaction to that situation. So for me, ready is, you know, green, good to go, I have no stressors. Good luck. If you're green, I want to know how you get that done. Yellow is, I've got a stressor too, but I got it managed. And I feel like most people feel like, you know, their stressors, sometimes they don't even really identify them, sometimes when they take the behavioral health survey, because they'll say to me, well, I mean, I do, but it's just normal everyday stuff. So for some people, even having stressors, they don't even consider it to be like yellow because it's just what we deal with. You know, paying bills, getting your car taken care of, new tires on my mind. Injured is when either the type of stressor or the amount of stressors or the duration of the stressors is really starting to create some wear and tear. And this is where somebody could really benefit from some support, needs support. Support should happen because we don't want you to get to red. And red is where, you know, we're kind of like in a crisis or we're just beyond our means to manage something on our own. And like I mentioned before, death of a family member doesn't mean you're not capable of handling that grief or that stressor, but having somebody there to support you will make it that much easier. So we use our OSC to determine our frequency of outreach. So if I'm doing an intensive case management case with somebody, just so you guys know, if you're green or yellow, my level of outreach is going to be every other week. If you're orange, it's going to be once a week. And if you're red, it's going to be twice a week. So we're really calling and getting, you know, to communicate with everyone. Right? So no matter what zone you're in, we're always trying to get you back to green. And then we have this caveat here, we're not a crisis line though. If there is an emergency, let Phop know after you've called 911 or gone to the emergency room or something, okay? We're not a crisis line. So one of the things that we have created is this 360 care model, and it's, you know, 360 is full circle, right? So for us, that means we want to capture you from the beginning of your career to the end of your career and everything in between. And so I have this responsibility to call, you know, the command twice a month and hopefully talk to 2 different people and kind of ask these questions like, hey, is anybody new? I'd like to get information for anybody who's new. Anybody who's leaving, anybody who's having life transitions, milestones, like somebody's having a baby or they just got pregnant, or, you know, any kind of stressors that we could just at least call and say, is there something that we can do? All right? So this is where we really communicate a lot with the command. And as I said before, if you get a phone call, a text message, or an email from me, but you did not initiate it, it's hopefully because I'm doing my job, checking in with the leadership to see who I should reach out to, and they're just responding to those questions. I want you to know that if you hear from a Phop staff member, it doesn't mean anything negative. It means that we're doing our job and that your leadership is keeping a pulse on you, and if our communication is reciprocal, we're going to be able to reach out to you if there's anything going on. Okay? Okay, so this is our referral resources from command, like I keep mentioning. And again, it does not mean anything's wrong. When I first started this job, I had picked up a phone call from a Marine, not even around here, but one of our staff members had left a message that, you know, Commander so-and-so or Captain so-and-so had asked her to call, or just that she was calling, I'm sorry. It was a PDHRA referral, so we just call everybody, but he didn't know that, and when he got me on the phone, he was pretty upset. He felt like this was just negative on him and that his command thought there was something wrong with him, and I really couldn't convince him otherwise. So again, it's just really important for me to stress to you, if I initiate contact with you, it's probably not a big deal. It usually isn't. BUMED, PDHRAs, PHAs, medical stand-downs, these are all events we want to be present for, or at least get referrals from. Self-referral is probably our biggest type of referral, and Battle Buddy. I've only maybe gotten 2 referrals from one Marine about another Marine. And just so you guys know, for me, I always ask the person who makes the referral to let that Marine or sailor know that they did that. Because I think it's important to have transparency and good communication and for everybody to feel like they're on the same page. And so anybody who makes a referral, just know that I say, hey, could you let them know that? Okay, so what to expect once referred. We will reach out to you to discuss your circumstances. Our standard first conversation includes, can I send you the link to the behavioral health survey? Can I find out where you live so I can send you a local resource flyer? And can I have your email so I can send you this information and our brochure? Okay? We'll communicate with the appropriate services about what we might be looking for on your behalf. And we'll just continue to correspond until you tell me you got what you needed. Or if I keep continuing to reach out to you for 2 months and I don't hear back, at some point I'll just close your case. Okay? So Resiliency Check-In. I think anybody here might remember I did one with malls a couple of years ago. Basically what we do is I try to come in on a drill weekend and I give you guys a PHOP brief and I have everybody right on the spot take our behavioral health survey. And then I spend the next month scoring the surveys and getting all my stuff ready. And I come back in, usually with a team member, the following drill, and we meet with everybody face to face. Now that's an ideal. We've tried to get creative in 2020 because of COVID. So we've been trying to do some of these virtually. And actually some of you guys might have gotten some of that information from VMBM back in the springtime. I tried to do this virtually. So this year moving forward, we're going to try to do it the best we can based on the circumstances and if we can keep everyone safe in terms of a distance. So I just did one in October with MWCS 48, but we really were able to be separated from each other so everybody was safe when we met in person. Why is that important? Because we get this after action report, which gives us a big snapshot of who's who and what's what in the unit. It's not broken down by MOS. It's not broken down. There's no identifying. As a matter of fact, on the behavioral health survey, the only identifier is your DOD ID. And unless I have that number ahead of time, I don't know who you are. So the only people that see the surveys are myself. They don't go to anyone else, okay? But that after action report will give the leadership a snapshot of who's employed, who's not, who's married, who has children, who's in school, who's health insured, just those basic demographics, but it'll also give some trends in terms of stressors. So maybe we might see a trend that health insurance is lacking for a unit, then we'll talk about bringing somebody in from TRICARE Reserve Select and giving you guys a brief. So I love the after action report. I think it's important for you to have this presented to your leadership so they really know who you guys are. Okay, so this is just basically telling you what happens with a resiliency check-in. Either somebody says, no thank you, I don't need anything, or they say, I don't want to participate. Sometimes they ask for a one-time resource, and sometimes they ask for intensive case management. It does say on here that if you do not request follow-up services, we'll still send you one last outreach, probably thanking you for participating. Okay, so this is the postvention response. I am grateful that I have not had to do this in a couple of years. When I first joined the team in 2017, I hit the ground running. Giving postvention briefs, and postvention is pretty much after a death by suicide. I think I might have done 3 in my first 6 months. And it is not an easy thing, but we are here to support you guys in case of death of a service member, especially death by suicide, and we have all the information to give to the command right away, as soon as you let us know, to help support you. There's some really good research-based information on what to do and what not to do in those cases. Try to come on site as soon as possible and give a brief individually or in groups, and even bring in local resource providers to maybe do grief counseling or something like that for the unit. So please let me know if you ever need anything like this. Hopefully that won't be the case. This is just basically a list of the types of briefs and the intervention and the education that we can do. The FPC, I know that not every unit has one, and every unit that does have one does it a little bit differently. PHOP loves to be included on those calls or those meetings. And even if you feel like you want it to be closed doors, anybody who is on FPC because they've been indicated as having stressors should be a PHOP referral. Okay, just want you guys to know. I know sometimes, you just want to kind of keep it in-house, but, again, we don't need to know the details from you. We just need to be able to talk to the service member and see if there's anything we can do to provide support. I know I'm standing up here on stage, but I do like to stop and ask if anybody has any questions. Okay. All right, so this is a list of some of the things that I mentioned that we like to be on site for. Back in the saddle. Thank you guys for having us here today. Okay, so this is our general Phop interaction. That's Melinda. Melinda's having a baby. She's in Fort Devens. So we do outreach via, telephone or whatever mode of communication we can to 2 command point of contacts every month. For those of you that take my phone calls, thank you. I appreciate it. And we do a monthly newsletter. You guys get the newsletter sent out to you during the month? Yes? No? Okay, thank you. Excuse me. I send that to my command distribution list, and I think that they push that out. We do regular outreach for any high-risk service members. If there is a flash report, if there's a MIP, if there's a sit rep, I am obligated to communicate to the leadership every week about that person. Again, only need to know, and the only time we discontinue that weekly command communication is when we've agreed it is no longer necessary. Okay? If we're on site, we try to be here as much as possible. I am one of the really fortunate team members. Not only am I working in one of my units, but I got y'all in one spot. I just had taken a Camp Pendleton unit back in January and just handed it over to a new Camp Pendleton person. So Miramar is where my focus is dedicated. And again, we're not a crisis line. So it is a little confusing, I think, even for us, but we have an after hours line. So you could call our 800 number any time of the day, and if you know your region, which would be Southwest, you could hit that prompt. If you just wanted to go to somebody right away, the staff person who's after hours hopefully will answer the phone. If they don't, then again, you could choose a prompt. If you leave a message, we try to get back to you within 24 hours. But remember, if there's a crisis, please let us know, but after the crisis has been handled. Oh, what did I do? Okay. So good, I do have my contact information on here. I sent a lot of briefs out this week and I wasn't sure. I would like you guys to either take a picture of my information and also our non-emergency number, because what happens a lot is after I give a brief is usually the following week is when I'll hear from some service members, either asking questions or wanting information. My office, anybody know where my office is located? Okay, so I am in building 6030. I'm in site support, and I am next to the career planner, who I think is speaking after me. Okay, so I had been in the office twice a week, but because of COVID right now, I'm in on Wednesdays, but I work Monday through Friday. So it's great if I get to meet with you in person, and if not, we do everything on the phone. I will be here all day. I'm giving another brief at 11, but if you would like to connect with me today, please take my number. You can shoot me a text message and we can coordinate a good time to meet up with each other at a safe distance. Okay? And I also have lots of fun things in my office. I have stress balls, I have some notepads, I have pens, I have some journals, tissue packs. I just got some cloths so you can clean your glasses with. So anything you want to just come by and grab that, feel free. So I thank you guys for allowing me to be here today and for your time and your attention. And before I close, I just want to know if there's anything I can clarify or elaborate on, or if you guys even had any feedback. Yes?
I got one question. A lot of the cases that you deal with, do you feel like they're kind of in correlation with similar to Stockholm syndrome, so it's everyday stressors, but it's kind of for people that just kind of adapt and kind of overcome what's going on.
Is that, you're asking, is that something that we kind of can observe?
Correct. I'm asking is that what you typically do?
So I think you're out here. No, so sorry. So you're asking if somebody might have like the Stockholm Syndrome, or where they're just so used to their stressors that they don't even notice it. Is that somebody we work with? Yes, yes. So, and I think that's where the assessment piece and where us being actual licensed clinicians is really important, because you and I have a very different perspective on our lives and our stressors than the outside person might be. And this is a good example. Thank you for bringing it up. You know, I train our staff, and we talk about the ask. And so sometimes there's been situations where I'll have a service member who just got out of the hospital for a suicide attempt. And when we talk about the ask, he says he's green. So this is kind of related to what you're saying. And I'm looking from the outside going, you just left the hospital for a suicide attempt. I don't really see green. I see more orange or red. And so that's part of us, you know, having that conversation with people to give that professional outside perspective. So, you know, if somebody is in an abusive relationship, they might be getting hit every day and say to me, yeah, but he doesn't or she doesn't cheat on me. Okay, kind of like what you're saying type of thing. And I might say, well, I think that's great that there's no infidelity. Let's talk a little bit about the physical abuse. Is there emotional abuse as well? So does that answer your question? Yeah, I think it's really important. My favorite thing is really to get somebody else's perspective, somebody else's point of view. And when I can't get it, sometimes I just have to drive a different way home. Because as soon as I change my sights, even if it's literally my sights, I can start to change what's going on in my head. So thank you for asking that question. Any other questions or feedback? Okay, well, I will finish. I appreciate everybody's time and attention.